Hi folks, Happy New Year. I'm falling behind in questions. I don't know if I should make this a little bit longer and include your questions or do this twice a week. I don't think you really want to listen longer than a few minutes, but let me know what you like. Anyway, here are the questions. I started to get questions from kids, so I'll answer those as well. I'll start with those because they're easier. Hi Dr. Mike, I'm 10 years old. Are you cool? Yeah, I'm cool. I don't know if my kids would say I'm cool, but I'm cool, like the Fonz. Google it. Next question. Hi, my parents said that if I cross my eyes, they will stay that way. Are my parents wrong? I wouldn't say your parents are ever wrong about anything, but I would say the likelihood that your eyes will permanently be crossed is almost zero. So it's kind of a wives' tale. But if your parents tell you don't cross your eyes, then I wouldn't do it. Okay, now we move on to the adult question. Dear Dr. Mike, my granddaughter has had a problem with her fingertips for over a year now. It began in the spring and has continued to be a problem. Her fingertips are so calloused from the cracking and peeling, which she contributes to by biting the skin off. We use bacitracin and Band-Aids for the deeply cracked and bleeding fingers, but just when they're healing, she starts biting the skin off again. A special note, she seems to have the bleeding fingertips after going through something that makes her nervous or upset. My question to you is, do you think this is an emotional behavioral problem, or do you think this is some type of medical condition? Thank you, Patty. Let me emphasize that I am not a substitute for your medical office, so all of these questions really need to be seen by a medical professional. So I'm not taking the place of that professional. I'll give you some recommendations and some information, but you still should be physically seen. You should take your granddaughter or have her seen by someone to look at her fingertips. So the question is there really a disease process where just the fingertips are affected chronically? I guess you could have, there's some transient, temporary peeling fingertip of the fingertips, but it's not a chronic condition. In theory, you could have some eczema, but it generally isn't restricted to the fingertips. So you, I think, sounds like you're on to what's going on, and it sounds like she bites her fingers when she's upset or nervous, like some of us bite our fingernails, or we have tics, or have stomach aches, but she may cope by just biting her fingers. She gets them wet, especially this time of year. Go outside, you get cold, they dry out, they get cracked. It further irritates it. Come back inside, she starts biting them, licking them, and so keeping them moist probably helps, but then when they get dried out, it gets worse. Now, there's a solution to the fingertip problem, but I don't think that's the resolution to why she's doing it. Just by keeping a nice emollient like a Vaseline on them to keep them moist, especially before she goes to bed. Sometimes it's good to, if kids will go for it, you put the Vaseline on their fingertips, you put a cotton breathable glove on both their hands so they can't bite it off, or they don't rub it off, it doesn't come off, and they're sleeping by the morning, their fingers are in good shape. That doesn't stop her from doing it during the day, and that doesn't resolve the problem of why she's doing it. So I think there's some things that you can try at home first, just like positive reinforcement, or not yelling at her when she's biting her fingers, like, hey, knock it off, or hey, your fingers are going to fall off. So you don't bring it to her attention or embarrass her, but gently discourage her from doing it, and then encourage her or compliment her when she's not doing it. These are just subtle things. But this may be a bigger issue than just that. Sometimes she needs to sit down and talk with someone, or you as a family need to sit down and talk with someone who can help her deal with her anxiety or her stress, like a counselor or a psychologist. So a lot of times it's helpful not just with the child, but with the family, so she can get some coping mechanisms on how to deal with stress in life instead of biting her fingers. This is probably not her issue. This has probably been passed down, or she's seen parents do it or grandparents do it, finger biting or hand wringing, or maybe they're chewing on their fingers or toes for that matter as well. Sometimes we see kids that actually bite their toenails, they're so nervous. So that's it for the questions. If this works, please like it. If this doesn't work, you don't like it, please tell me why it's not working. Tell me if it's too long or this is too short, if I should do this twice a week, just to get caught up. Anyway, thanks very much. Have a great week. God bless. Bye-bye.
Sunday, Monday, happy days. Tuesday, Wednesday, happy days.